2023 with Eric Parker.
Welcome back. Last week, Dr. Manisha Juthani was formally reappointed as the commissioner of the Connecticut Department of Public Health. Much of her time in that position, of course, has been focused on COVID. So what's her focus as she continues in that role, and how will the end of the federal COVID emergency impact the state? Commissioner Juthani is joining us once again here on the show. Welcome. Thank you for being with us once again.
Thanks for having me.
I want to talk about lots of other things because when you've been on in the past, COVID has been so much of the focus, and we've spent a lot of our time in our interviews talking about that. But I do want to talk COVID first because we did hear this announcement from the Biden administration, and I just want to know if people heard that news, what does it mean for us here in the state of Connecticut that the federal emergency will be ending this spring?
So an important thing to remember is that the federal emergency allowed the state to get reimbursement for a lot of important functions that we provided. For example, many of our testing sites, a lot of PPE, a lot of emergency response that we were able to provide. And in addition to that, so many people had expanded healthcare benefits because of this federal emergency. So what we want people to remember is that if you got access to things that you didn't have before this emergency, to really connect with your insurance company, with Medicaid program, other services throughout the state to figure out what those stopgaps might be to be able to help retain as much access to care as you need.
And moving forward, obviously, we want to talk about your other priorities, but COVID, is it still a big one? Is it still something that you're dealing with and your department's dealing with every day? Is there still work to be done on that topic?
You know, I think what we often forget about is COVID is still here. People are still being hospitalized for COVID. People are still dying from COVID. And our healthcare system is able to manage it. Our peak this time around this winter was in the 750s of the number of people in the hospital. It was up to almost 2,000 last year. So that's a reflection of the amount of collective immunity we do have. But we still have over 400 people in the hospital right now with COVID. That's more than people with flu in our hospitals. And so it is something that we do need to keep in mind, but we are able to manage it as a society overall. And this just brings up the larger topic of emerging infectious diseases in general and how we have to be able to respond to any threat that we might have. And our system was really tested with the emergence of Mpox, what was formerly called monkeypox, where we were able to respond in a way because COVID prepared us to do so.
Well, let's talk about some of those other threats. Obviously, there's, the tried and true. There's flu season, which we're smack in the middle of right now. You talk about Mpox. You talk about some of the other things that are out there. So how has your experience and the department's experience with COVID talked to those other priorities, and what will your priorities on those other infectious diseases be moving forward?
We need to be vigilant and aware of any of these types of threats that are on the horizon. And that is part of what we do every single day. The Department of Public Health is constructed to be able to monitor for data for diseases that are coming in, and that we collect that data, review it, and be able to put it back out so that the public can understand what it is that we're seeing. So we will continue doing this. I do think we are seeing the downturn of COVID. I hope that we don't have another spike in flu. Sometimes we do have a later one in the season. We may this year. That's what we stay vigilant for. But we do anticipate that we're going to end up in a yearly cadence of COVID and flu shots that people require. And I think we've seen through the last 3 years that the winter is still the worst time when these diseases have their impact. It doesn't mean that people might not get COVID in the rest of the year, but we're going to really be focusing our efforts on getting people to not tune out the guidance about being up to date on vaccinations for COVID, but to remember as we hit each fall and winter season to stay up to date on getting those shots.
One of the things you and I have talked about at length in these interviews was the slow response and an inflexible CDC and federal government and not being able to move swiftly and adapt in those early days of COVID. Are there any positive signs you can point to? This is such an area of expertise for you. Is there anything that we've learned that we say, well, now if there's a new threat, we're going to be able to respond better, and the people of Connecticut, whether it's at the Connecticut department, at your department's level or the federal level, should rest assured that if the next thing comes down the pike, we're ready to move a little quicker and be a little more nimble?
So one example of that is the Department of Public Health has received over 20 million COVID tests over the last 3 years. In a given year, we probably see before COVID somewhere around 1 million tests. Our data infrastructure has had to scale up in a way that we did not have before this pandemic. And so I do think that we've seen an influx of funding from the federal government to be able to help us respond in that way. And for me, Mpox was the real test of that. And the fact that we're in a place where we have had maybe 1 or 2 cases over the last 2 months, but really got that infection under control in our state really is a testament to the tests that we had to endure as we were still dealing with COVID. But I do think that one of the other things we're really trying to do now as a department is refocus on all those other areas of public health that had to be on the sidelines during this pandemic, whether it be sexually transmitted diseases, gun violence, the opioid crisis, mental health, all these areas that are important public health issues that we can refocus on while still not getting our eye off the ball on those infectious diseases.
Well, listen, we'll let you produce your own segment. Let's tell us about some of those other focuses. You're not the commissioner of COVID, you're the commissioner of public health. So we have about 2 minutes left. Talk us through some of the other things you're going to be working on now that you've been reappointed.
So I mentioned gun violence. We know that this is a major focus of the administration, of the governor. And one of the ways that we as a Department of Public Health have been very involved in this is that in the last legislative session, there was a commission on gun violence that was set up. We were entrusted with $2.5 million to give out to community groups, which we have been meeting over the last 6 months to really figure out how to do this best and to help identify the priorities. And that is going to be going to a request for applications where that money can get out to community groups who can make those interventions on the ground. The opioid crisis, there's been all this opioid settlement funding that's going to be going to the Department of Mental Health and Addiction Services. But we as the Department of Public Health participate in that as well because we have eyes on where opioid overdoses are happening in our state. If there are pockets where things are bubbling up, how we can work with other harm reduction methodologies that we have in our state. So ways that people can get Narcan, for example, to reverse an overdose. And so we're going to be very involved with our sister agencies in really getting that type of intervention out in our communities all the time while working with our local health departments and building up our workforce, which we need both in public health and in the healthcare sector.
Well, I know when you were reappointed, you said you had a lot of other priorities. We're all out of time for this morning, but I know lead in children, PFAS, RSV, you mentioned sexually transmitted diseases, a lot of important things we can talk to you about. And I'm happy to say we'll definitely have you back on to talk about some of those. Like we said, you're not the commissioner of COVID, a lot of important information there. And I'm glad we could talk about some of the other things. We'll have you back. Commissioner Manisha Juthani, thanks for being with us here on CT23.
Thanks as always for having me.